Well, for more on the status of the U.S. healthcare system, I'm joined by Scott W. Atlas. He's the David and Joan Traitel Senior Fellow at Stanford University's Hoover Institution and a member of the Hoover Institution's Working Group on Healthcare Policy. Thank you for joining us.
Nice to be here.
Now, this really has been a battle in D.C. about reforming healthcare, but what's the reality for the rest of the U.S.?
Well, the reality is that since the implementation of Obamacare, we've seen a lot of things happen that Americans didn't expect who weren't familiar with really what was being done. And that is that health insurance premiums have skyrocketed while the deductibles have also are going up. So that means that you're paying more out of pocket before insurance kicks in, but the insurance is more expensive on top of it. The choices of doctors and hospitals are less because most doctors more and more are not accepting that insurance even if you get it. And the choices of insurance coverage also are much less than they were pre-Obamacare. So what's happened is that because of the hyper-regulation of Obamacare and the new regulations and mandates and taxes, things are much worse than they were pre-Obamacare.
So what would you say are the main underlying problems with the U.S. healthcare system as it stands now, and what are some of its advantages?
Well, let's first talk about what was good even before Obamacare came into play. Despite all the mythology about what's happening in the U.S., the reality is that the U.S. healthcare system offers the best treatment outcomes from cancer and other serious diseases, the best treatment outcomes for chronic diseases, the best access to care for chronic diseases, the quickest access to surgeries that are important, the quickest access to new drugs, and the U.S. is the source by far more than anywhere else of the world's innovations in healthcare. All of these things were actually true pre-Obamacare. The problem is that the system is quite expensive. As you in your intro noted, it's more money than anywhere else in the world. Now, if you take that situation and then add in the demographics of the U.S. society, that is the aging of the population, and the obesity, the harboring of risk factors like cigarette smoking and obesity, this threatens to overwhelm the system. The public plans, which are for poor people and elderly, are unsustainable because of the aging population and the decreasing workers, really, relatively speaking, that are paying for the senior citizens' care. And there's all kinds of things that have been happening that Obamacare doubled down on and worsened. That is, there are bad incentives in the system that predated Obamacare. For instance, insurance in the U.S. has been really trying to minimize out-of-pocket payment and therefore obscuring what you're actually paying for. And so when you don't care what something costs, you want to use it and overuse it, and there's no constraint on the price whatsoever that we would normally see with every other good or service in the U.S.
Now, Scott, speaking about spending, most healthcare experts agree that the U.S. spends about $10,000 per capita on healthcare, which is more than the 11 other wealthiest nations in the world. Yet, the U.S. has the lowest life expectancy and quality of care among those countries. So why isn't the spending matching the health outcomes?
Well, I'm going to take exception to what you said. You said something true, which is that the U.S. doesn't have the best life expectancy. But life expectancy is not really a reflection of healthcare quality. It's what we call a very coarse statistic. Cause of death, lifestyle habits, all kinds of things go into a life expectancy that are separate from healthcare quality. And I just said, if you look at the data from the medical journals, the U.S. has outstanding healthcare quality. So it's not really true that the quality of the system was the problem.
Well, some experts would disagree with you, but as you mentioned, in terms of incentivizing people, does the U.S. government do enough when it comes to, say, providing people to become doctors and to become healthcare providers, especially, as you mentioned, with more baby boomers coming in to care for?
Well, there is an important doctor shortage coming, and this is one of the key parts of healthcare reform that should be changed in the U.S., because the reality is that the reason that there are so few doctors is not so much that there's not enough incentive. It's that there are actually obstacles in place that prevent more doctors from being trained. Medical school graduation rates have plateaued for 40 years in the United States. Medical subspecialty societies have artificial constraints in terms of how many doctors are produced each year and trained. And all of these things are barriers to competition. We need something very important to happen here, which is to increase the supply of healthcare providers, both for specialists that are MDs, as well as for primary care. We need to loosen the regulations so that very low-level primary care, routine care that can be done by non-MDs should be able to be done, like by nurse practitioners and physician assistants, and that's much cheaper with the same quality outcome. So there's a lot of things that need to be put in place to increase the supply of doctors that importantly would decrease the price of medical care. And that, to me, is how you get better access for people on private insurance, as well as better access and cheaper costs for government insurance programs. It's the cost of care that is the problem.
Sorry, unfortunately, we'll have to leave it there. Thank you so much for your insights, Scott W. Atlas there.